Hey guys, thanks for stopping in. I had the TV on last night and I saw one of those animal cruelty commercials come on, and it made me start thinking, what about pain patient cruelty? I keep getting these comments on my videos when I talk about chronic pain and medication, and I get comments all the time. People say, well, they just cut way back on my medication, or they just completely cut me off cold turkey. And a lot of these people have been taking it for a lot of years, and it's like, it's just not right. I mean, you get where you kind of depend on that. I don't know if you want to say addicted, but people are saying, I could at least somewhat function when I had my medication. It's like, and then like now, I can't even hardly get out of bed. So, and that it's just like some of these people, it's just like without any warning, they're just getting cut off. And it's because of, all these laws, the war on drugs, the opioids, all that. And the doctors are just getting, paranoid. They don't want to, they're afraid they'll lose their license. I was just watching a video a little bit ago, and it was about this older lady. She was a doctor and she had a private practice, and she didn't want to deal with computers and all that. So, she was just, doing everything old school, records by hand, and she was prescribing opioids, and she got her license taken away because, she wasn't putting everything in the computer so it could go into this database and all this crap, and she got her license taken away. So, and it sounded like, she was actually trying to help a lot of these chronic pain patients that nobody else would help. You always just, get accused of, being a drug seeker anytime you go to the doctor with chronic pain. In fact, the way that I recently had double spinal fusion surgery 7 months ago. It was my third back surgery, and the way I happened to find my surgeon is about 5 years ago or so now. I had a really bad flare-up in my lower back, to the point where, it was just excruciating. I could barely get out of bed in the morning, and all I could do was hang on to the wall, and basically I was just in tears. My wife said, I don't think I've ever seen you cry. So she knew it was bad. I actually had to call an ambulance to come and pick me up to take me to the hospital because I couldn't sit in the car. I could barely move. The pain was just that bad. And so, I went to the emergency room. I actually spent the night in the emergency room. They pumped me full of all the drugs they could, and they're like, well, there's nothing more we can do for you. So they sent me home, and stayed home for a day, and a day later it was so bad I had to go back again, and right off they're like, well, you know what, you can't just keep coming back for drugs and and my wife got really upset, and she's like, you don't understand, he has drugs at home, but he can't even move. And so basically they admitted me again and started pumping me full of painkillers again. And it just so happened that the doctor who was my surgeon, my spine surgeon, he was on call, and he came in and kind of, talked to me a little bit, and he leaves and he comes back and he puts all this stuff in my IV, and he's like, see, how that works out for you. And they had me spend the night again. Next day I could get up out of bed on my own, and he came back in, and I was standing up because, wow, I didn't really expect that. I'm like, I don't know what you did, but I think he put some kind of steroids or something in my IV. But whatever he did, it worked. And so then I was going to have him do my fusion surgery around that time, and then I got really sick. I got endocarditis for the second time in my life, and actually I almost died. I ended up having to have a open heart surgery, heart valve replacement, because basically the bacteria ate up my heart valve. So almost died on that one. I was in the hospital like 17 days on that one. But anyway, that's a story of how I found my back surgeon. But right there it shows you go to the emergency room and nobody wants to deal with you. You get accused of being a drug seeker. You're just there for the drugs. Even though, I mean, it should have been pretty obvious by the pain I was in that I wasn't, you know, that I wasn't faking it. But, you know, nobody knows who I am there, so they see you. And I guess, like one doctor, I saw a video, do a video the other day, and he's like, you know, we see patients for a few minutes and we have to decide what's going on with them. So he goes, unfortunately, there's a lot of people who are out there just for the drugs. And so those are the people who screw it up for all us legitimate chronic pain sufferers, whether they know it or not. They're, you know, and they don't care because they're just basically addicted to the drugs. They take them for sport, but they're the ones screwing it up for the rest of us. And you know, the government's just trying to put a stop to that, and we just kind of fall by the wayside. They don't seem to care much about what happens to us at all. Anyway, thanks for watching, you guys, and I'll talk to you next time.